shine, love.
Let the sun shine.
And let it shine on in.
Let the sun shine.
When you open up your heart, you got to let the sun come in. Hey, let it shine, love. You got to feel, you got to feel it, 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 feel it,
Okay, so I'm Sasha Dagnall, and this is Riley Dagnall. She's 7 years old. She's a patient here at Connecticut Children's Medical Group. We found out that Riley was sick last June. It all started back in about April, and she's a normal 6-year-old kid full of energy, loved hanging out with her friends, loved playing outside. There was 1 week where there were a few days where she was a little extra tired. She didn't want to get up to go to school in the morning, and I called her pediatrician. And I said, is it possible for a 6-year-old to have mono? And they said, well, it's highly unlikely, but it's possible, so bring her on in. And they brought her in, they did some routine blood work. Came back that she was slightly anemic. And we did a vitamin with iron for about a month. And we went back the next month for another blood test, and it was completely normal. And he said, luckily, that he wanted to do 1 more month of testing just to make sure. And that month, we went in on a Monday, had her blood work done. He called me Tuesday and said, I need you to come back in. And I said, oh, well, she's got swimming lessons, and she's got this, and she's got that. Does she have to come, or can I just come in and talk about it? He said, no, we really want to see her too. So we went back in, and he said, well, there's some cells in this blood work that we're not real happy about. We're not, quite sure what it is at this point, but I've talked to a friend of mine, Dr. Altman, and I've set up an appointment over at Connecticut Children's Medical Center for tomorrow morning, and I need you to be there at 9 o'clock, and it could be something as, simple as her just being severely anemic, or she could have leukemia. And that was the first mention of any of that to me. I was a little taken back. I was a little scared. I didn't sleep much that night, I can tell you that. We came in the next morning. From the minute we got here, everyone was just unbelievably wonderful. I mean, Riley had only ever had 2 blood tests in her entire life, and now they were telling her that they were going to be putting this IV in her arm and had to do everything. But between the nurses and the doctors and the well, we love Melissa, and Christine, who helps the kids with all of the distractions, and everyone has just been absolutely amazing to us.
So Connecticut Children's is unique in that we're the only freestanding children's hospital in Connecticut. We focus solely on the patients and families, the children, and their parents and extended family members, their siblings. We do a lot of special things other than treatment. We distract them with fun, with water guns and games and crafts, and we have great child life specialists. For each child, find out what they like to do, what can distract them from what's going on. In other words, as long as the kids can keep being kids, then we can do what we can do without taking too much away from their everyday lives.
The new unit will increase the space so kids have their own space, the staff have their own space, and it will be a little bit neat and clutter-free. It'll allow us to perform our duties in a safer manner. The space is definitely needed.
Let it shine, love. Oh, let it shine. Now everybody just sing along and let it shine on in. And when you are lonely, and when you are lonely, you got the feeling. You got the feeling. You got the
give to Connecticut Children's Medical Center, because even though I'm here today with Riley and we're doing great and we have smiles on our faces, it wasn't always this easy. And those first couple months and weeks were extremely difficult, and yes, the doctors and nurses here are great and provide amazing care. More needs to be done.
You got the, you got the, you got the, you got the.
Let the sun shine. Let the sun shine in. The sun shine in. Let the sun shine. Let the sun shine in. The sun shine in. Let the sun shine.
Oh, let it shine.
Let the sun shine in.
Open up your heart and let it shine on in. Hey, let it shine, love,
Let the sun shine.
and let it shine on in.
Let the sun shine.
When you open up your heart, you got to let the sun come in. Hey, let it shine.